I want to start by introducing myself. I'm Annette Ashley. I'm with the State Bar of Wisconsin. I'm the Director of Professionalism and Engagement. And one of the roles I have is overseeing our member benefits. And this association or group health plan for law firms is one of the things that we have really tried to showcase and promote, because it does offer a lot of positive benefits in terms of reducing costs for law firms out there. I want to introduce with us today is Christine Nadolski, and Chris is with the Professional Insurance Programs. She has been helping us with this over the past year in explaining and answering all of our members' questions and helping everyone get a better understanding of what the group health plan will do for you. I would just like to give you a couple housekeeping matters before I turn it over to Christine. If you have questions, please feel free to put questions in the chat box. I'll be watching the chat box, and then at the end, we will have Christine answer all the questions that come through there once, so that it helps her with the flow of the information in the PowerPoint that she's put together. So with that, I will turn it over to Christine.
Thank you, Annette. I appreciate that. I'm obviously Christine Nadolski. I am the benefits department team lead. I've been with professional insurance for 16 years. We have Wendy Block also, who is my team member, and she's celebrating 5 years this year. So big shout out to Wendy. As we go on, we want to point out the differences with the State Bar Association health plan versus the individual healthcare market. And a lot of smaller firms are hesitant, or even larger firms are hesitant to offer group health insurance coverage as a benefit for several reasons. The four listed here are actually the main reasons that we've kind of gathered as far as why individuals aren't offering association group health coverage. Lack of participation by employees. A lot of times there's maybe only one or two or three, I should say, individuals that are working in a smaller office. With the State Bar Association health plan, all we need is one full-time person enrolling and one full-time person that is waiving or declining coverage to establish a group. So that actually gives a lot of freedom as far as employers offering coverage to their employees. Employer contribution limits are a big financial hit sometimes, especially with smaller firms. With the other carriers and the Affordable Care Act plans that are available, you have to have a minimum of 50% of the single employee premium that is your employer contribution. When working with WPS and keeping small firms in mind, us at Professional Insurance Program said, you know what, let's reduce those hours. 26, or let's reduce that contribution. I'm jumping ahead of myself. So we actually eliminated the employer contribution limits, and an employer can contribute anywhere from 0% to 100%. And that can be for the employee or even the employee's dependents, depending on what your office policy really is, or your firm policy really is. Employees working less than 30 hours, that's huge. A lot of employees work a little over 25, but not quite 30. They're not considered full-time on any of the health insurance plans because 30 hours is your threshold. Now, with the association plan, we actually lowered that to 26 hours. So smaller firms, people who work less than 30, but more than 25, they're kind of in that limbo. They're actually able to get health insurance, and a very good health insurance plan, on a group basis. Limitation on plan offerings. Some carriers will offer, depending on group size, will offer only one plan offering, especially if you're under 5. With the association plan, you can offer up to 4 different options from our 9 options that we have, as long as we have an employee in each option. This gives a little bit more flexibility when we're looking at your employees and their family and finances and what they can really put out on an annual basis for their deductible if something were to happen. Now, we're going to dive a little bit deeper into how the association plan and individual coverages compare. Now, with your association plan, your employer or you as the employer would purchase this plan. On an individual basis, you have to seek out, as an individual or family unit, your own coverage, meaning that you'd have to probably go to an agency like us, or another agency. You'd have to go to an individual broker, or you'd have to go to healthcare.gov to seek out what type of plans are available. One call and we can set you up. We can definitely take care of that information for you. Network size, this is huge. On the association plan, you have a statewide to national network depending on your plan. Groups tend to have more of a broader network when it comes to network providers. WPS Health Insurance actually has the broadest, which is a statewide network, and it encompasses about 98% of all your providers within the state. Plus, it has the national wrap that you can travel anywhere in the United States and actually still have in-network coverage. Now, WPS Health Plan is a little bit narrower. That one has a tendency to have more of the Aurora, the Bellin, Ascension providers, and definitely Children's Hospital, a network within the plan. Still has the out-of-state network, but it is a little bit more conducive to the providers that I listed. Now, network size on an individual plan will actually be more of a regional area. So if you live more so in, say, La Crosse, you're going to have providers within that area. And anytime you go outside of your network area, you're going to be out of network unless it's an emergency situation. Having out of network coverage on an individual plan, there's actually no, most of the time, there's no out of network coverage or limits. So it's an out of pocket expense. And without those limitations on how much you can actually spend out of pocket, it could be astronomical if it's not an emergency situation. But I would think if it would be astronomical, it would be then coded as emergency. But you never know. On the group plan, the association plan, that's selected by the employer, most plans have, like I said, some type of barrier, some type of limit when it comes to out of network services. So they're capped off. So as soon as you reach that out of network service limit, then your plan will start picking up and paying as 100%. And that again is only for out of network charges. Now, enrollment timeframes. Now, we're all aware of the annual open enrollment because it's drilled through us on TV, through emails, through phone calls. It's very, very nice how they all tend to get our phone number somehow or another. An individual can only apply during an open enrollment period, which is November 1st through December 15th. For January 1st effective date. The only exception to that is if you have experienced a qualifying life event, meaning a divorce, a marriage, a birth of a child, you moved from the area that the servicing area, then you're able to apply for an individual plan. Or right now with the plan that President Biden had signed, that's till this August 15th. So you have a special enrollment until August 15th right now, but after that, you have to wait until the annual open enrollment period. That doesn't help a lot of people when they're looking for coverage and they need it and they want it like the first of the month in October. Well, with group plans, you can establish a group plan at any time during the year. It will be effective the first of the month, but this gives you the opportunity to really research the coverages that you want, that you like, and not be rushed as far as fourth quarter. We all know fourth quarter, especially in our world in insurance, is crazy insane. So applying at any time for a group plan, it just takes the ease off of it. It just takes the burden off of that year-end type stuff that you have to get taken care of. Contribution options, we have a few for the state bar plan, which is nice. You can have a total 100% employer contribution. You can have cost sharing with the employer and the employee contributing to both that premium, or it could be, again, the employee only if the contribution level is 0 for the employer. With the individual health and the family health, you're paying 100% of that premium. There's pre-tax deductions from payroll. If you do an employer plan, that we can do with a section 125 or a premium only plan. If you do not have such a vehicle in place, then the deductions from payroll would be post-tax. So it's always nice to get that section 125 established. So then that way, it really does help the employees out as well, because their income is decreased by their deductions for their medical coverage. And then any tax benefits for the individual premium is post-tax. You can't pre-tax it. So it's a nice, definitely a nice benefit for both the employer and the employee. With rating, now there's a couple ways of that insurance carriers actually rate policies. The individual health insurance is actually determined by your age, gender, zip code, and tobacco usage. It is age-rated policies. There's no discounts whatsoever within that group for individual coverage. Now, small group also, normal, the ACA plans that you can get, anybody can get from 2 to 50 employees. They also do the age rating. With the association plan, it's composite rated or it's blending rating, which benefits actually the older employees because you're actually taking all of your single individuals, your limited family, which is employee and spouse or employee and child or children, and then all of your families, and you're combining these groups to make a blended rate for this employee will have this rate, limited family will have this rate, and all families will have this rate. And it doesn't matter if you have 1 or 10 children, the rate is going to be a family rate. There is a 15% discount on groups of 2 to 9 that WPS has actually installed this past year. So it gives a little break for the smaller firms, which is nice. The cost of coverage for the employee on a group plan, it is normally less, because the employer contributes tends to contribute toward the premium. And a lot of times we don't realize that, we forget that once we go on state continuation or COBRA, and they say, okay, your premium is $800. You're like, but I was only paying $400 out of my check. It's because you're taking on 100% of that premium, like you would if you were an individual. It's solely, individual plans are solely paid by the insured. They are normally more because the employer contribution isn't there either. So that was a big slap in the face to me when I first started working, and they're like, well, you can take COBRA. And I said, but I don't have a job now. So it's kind of like, all right, wait a minute, I can't afford this right now. So it is a great benefit to offer your employees, definitely. Where are you going to buy these wonderful plans that we're offering? The association health plan is offered exclusively through professional insurance programs. You cannot buy this plan from any other agent, any other agency. If they tell you you can, you better call us, because this is exclusively through our agency. Individual plans you can buy privately through an agent, single agent, an agency, or you can go through the marketplace for healthcare.gov. Now, I personally like to have a little bit more hands-on attention with when I have questions. So if you have a program through us, you call us. We'll research the information. We'll get back to you. We'll find out what is happening. Where if you go through the marketplace, you're basically calling the marketplace and you're in a queue, and these individuals may or may not know everything that they need to know about your particular policy, because they deal with so many. Selecting the plan is actually fairly easy with the association plan, because the employer researches these options and talks out the best options with us. And again, making sure that you have options that are available. We can offer up to 4 different plans within the association plan. So this gives you the opportunity to select and customize your plans a little bit more than just a plan that you are applying for on the marketplace. You're able to say, you know what, I know that the expenses have been really hard for Susie this year. We're going to go with a little bit lower deductible in case something happens. We want to make sure she's able to afford her out of pocket. Now, with selecting a plan on an individual basis, there's, depending on which region you work that you live in, because it is all based off of your area zip code. You could actually have up to 5 carriers and possibly 4 or 5 plans that you have to sift through. We're looking at 20 plans possibly that you have to look through and decide which is going to be the best coverage for you. We like to take that out of the equation on the association plan. Coverage options, again, you select your own coverage. Most individuals, in my experience, actually choose the plan by cost because they know it's going to be an out-of-pocket expense. But when you're looking at coverage, you want to say to yourself, if I pick a $10,000 deductible and I have a family, that's going to be $20,000 just for deductible. Am I able to afford that for my family if something happens? Because they're paying premium that is lower so they can have a higher deductible and not have so much out of pocket. I really, really like the plans that we have, and you're able to select up to 4 different options. And we'll touch base on the plan options as well a little bit later. Now, plan changes, if you've ever had an individual policy and it was a certain deductible and a certain copay and a certain co-insurance, and then you're out of pocket max. Most of the time, those do change every year as open enrollment. The carriers reevaluate their plans. They get rid of plans that aren't so popular that you may be enrolled in, and they map you to another plan that's close, but not the same as your current plan. Your deductible could go up anywhere from $50 to $1,000. Out of pocket normally goes up as well, your max out of pocket. They could add on a deductible for prescriptions. With the association plan, it actually stays the same every year. You'll get a renewal, which your premium may increase, but unless the employer initiates a change, your plan will stay the same. So if you have a $750 deductible copay plan, and it comes renewal time and you say, oh, that's not such a bad renewal. It's not going to change to an $800, $900 deductible unless you decide you want to change to a different plan that is offered. Now, emergency room coverage with the association health plan, there is an enhanced emergency room coverage with the WPS copay plans. There's a $300 copay, then your co-insurance, but your deductible is waived, which is huge. In individual insurance world, the emergency copays do vary depending on the plan, depending on the carrier. Deductibles and co-insurance may apply if you aren't admitted into the hospital. There's also enhanced x-rays and lab work, WPS copay plans on the association. The deductible is waived again, and you're only subject to the co-insurance, which is normally 80-20. So 80% in network, 20% out of network. With the individual, this is all applied to the deductible and possibly the co-insurance. Again, it depends on the plan design and the carrier. Now we have some additional no cost added values. Now, I know a lot of carriers are starting to offer more incentive for their plans, more core value products. Individual options will offer a virtual visit, some type of telephonic phone call that you can connect with a provider. And again, the benefits vary by carrier. With the association health plan, we have an exercise reward program. We have an active and fit direct program. We have an iMed vision care discount program. Telehealth is actually offered through Teladoc. So again, you can call a licensed physician, you can video chat with them, you can do it online, however you want to connect with your provider. They do give you the options, and you don't even have to get out of bed. If you're sick, you can stay in bed and talk to them, and they will diagnose and possibly call in a prescription that's non-narcotic. Most of the time it's ear infections, something that you need an antibiotic for, just the very simple things that you really don't want to get dressed, go to the doctor for, and pay that extra additional copay, doctor office visit, sit with everybody else. So you might as well be comfortable and not put yourself in any more harm, most definitely. They also have a Here in America hearing plan discount program, and then a zero drug copay on selected preventative drugs for the most common conditions. That's huge. Long are the days where your generic blood pressure, generic cholesterol pills, you're going to go to the pharmacy or have it mail ordered. It's a $0 copay. So that's a great benefit. HR compliance is a big buzzword right now. We offer through the association health plan the HR compliance through Mineral, which was formerly known as Think HR. This is a free product, free service that we offer to all of our group clients through professional insurance programs. It is a vast library. You can chat with individuals as well, get the answers to the questions that you may not want to wait for someone else to answer. We've used it many times. We have many clients who use it as well. When you are on an individual plan, you don't have that benefit. So it's another perk to that association business, most definitely. As promised, we'll go through a little bit of the plan designs. We have 5 copay plans and 4 HSA qualified or high deductible health plans. You'll hear HSA or you'll hear HDHP. They're interchangeable. They added in the high deductible health plan a few years back, and it makes sense. So your copay plans, we have, it starts at a $750 deductible and goes to a $5,000 deductible. We do have two options with the $5,000 deductible, where you can have 100% coinsurance or 20% coinsurance to give that option. With the copay plans, your primary care provider is $25 copay and your specialist is $50. Your high deductible health plans range from $2,500 to $6,550. Now, again, we offer two of the $2,500 deductible, one with 100% coinsurance and one with 20. With the lower deductibles, those $2,500 deductible options, those are non-embedded deductibles, meaning one insured will have a $2,500 deductible. And if it's a family unit, the rest of the family would have a $2,500 deductible cumulative that they would have to meet. Once the family or that individual meets a $2,500 deductible, the plan will pay accordingly toward the, with the coinsurance. So that is one thing. And of course, these are all individual deductibles. Family deductibles are 2 times what you're seeing right here. So that actually wraps it up for us. So if you do have questions, please put them in the chat box. You can reach Professional Insurance Programs at info@profinsprog.com, at our toll-free number 800-637-4676, or check us out on the website at insuranceformembers.com. We do have a section just for our state bar members with plenty of information and offerings, not just health insurance, business insurance, workers' comp, you name it, we have it all on our website for you. So Annette, did we get any questions?
Yes, we have one question that was submitted in the chat, and feel free, if there are others, go ahead and put it in the chat and I'll mention them to Christine. But the first one that came in is, are these types of plans available for solo practitioners and their families, or do you need to have employees?
Since they are, and that's a very good question. Since these plans are true group products, we do have to have 2 full-time employees in order to offer the coverage. So one waiving, one declining, or both insuring, in order to establish that. These, and I forgot to mention, I apologize, these groups being a large group, we can send you out the preliminary rates. As long as we get a census, we can send those out. They will go through underwriting for their final rates. So pre-existing conditions are a factor in looking at underwriting and projecting those final rates, but preliminarily we can get those to you. The rates do change when the census changes. So if you list 15 individuals with all their families and all of a sudden, oh, no, only these 5 want to go and they're all individual, we will have to re-quote that and rerun it through underwriting, just in case we did have final rates already, in order to provide you a new final rate, because the cost sharing has actually changed. So.
And Christine, I have a follow-up question to the one about, are these plans available to solo practitioners?
Yes.
Isn't it, you need to have one lawyer and 1 employee, but the employee needs to be a non-family member?
Correct. They do have to be a non-family member in order to apply for the coverage or waive the coverage. And I can double check as well through our underwriter, our head underwriter, just to make sure. But that is, I know in some instances we've had, not with the association. there's like a special enrollment for one person groups that's actually at the end of the year. But let me just verify, just so I can get back to you on that.
Okay.
And make sure that I'm speaking correctly, but I do believe we are correct that we can only have non-members, family members, as far as the
The
group
plus one.
status.
Yeah, the plus one that gives them the
Yes,
group.
thank you.
If there are other questions, feel free to either put them in the chat or raise your hand. I can pull up the participant list and see who has their hand raised. So feel free to ask questions.
Oh, definitely. And I want to thank you again for taking your time out of your busy day to learn about your association plan. We've created this plan specifically with you in mind. So we want to obviously make sure we're giving you the best possible service, best possible plans available. And WPS has quite a reputation for being one of the leaders in Wisconsin for the health insurance.
Chris, I'm going to ask you a question. I believe in what I remember reading about the plan, that you have access in this plan to within network to some very high-end care, even through the Mayo Clinic. Can
Yes.
you kind of touch on that so that folks know network doesn't just mean in Wisconsin?
Absolutely. Now, with the nationwide network, a lot of individuals do question if Mayo is in the network. It is. We have South Dakota, North Dakota, and Minnesota has Select One network, and the remaining parts of the US has First Health Network. So again, you have coverage wherever you are going. You have the ability to go see some of the best doctors within the US, especially with Mayo Clinic being more of a specialty type clinic and hospital. You can see these individuals and be in network as well.
Great. Here is a question that came in. Can you talk more about establishing a Section 125?
Absolutely. We actually work with a third-party administrator, Diversified Benefit Services, out of Heartland. So they are also a Wisconsin-based plan. The Section 125 will again allow you to deduct premiums for health, dental, and vision out of your employee's payroll on a pre-tax basis. In order to establish a Section 125 or a premium only plan, we call them a pot plan. So if I refer to that as a pot plan, that's what I'm talking about. We send a request to Diversified Benefits, and our contacts there will generate the proposal for you, spell everything out as far as how much it is per person, any additional fees. So they actually are a phenomenal group that we work with, and they're very respected. The response time is amazing. Anytime I have a question, I have it same day response, if not early the next morning. So you would start that process again with us once you decided that you wanted to establish a group plan, or if you already have a group plan in place, we can establish that for your current group.
Okay, we have another question. How do I get a census to get an initial rate quote?
Perfect question. We do have that available, a request available on our website. If you provide your name, email address, I can get that out to you as well with additional information on the plan and the different services that we're able to offer. So you want to go to or you can email info@profinsprog.com. So many ways of getting census information to us.
We also have a link on the State Bar website under insurance for healthcare. And when you click on that, it goes directly to the State Bar page on the Professional Insurance Programs website as well. So
thank you on that.
And if you have any questions, just feel free to let me know, and I'm happy to provide the link as well. So
fantastic.
Another question is, do you offer HSAs, dependent care deduction options, or life?
Yes, we actually offer all of those. I know that Diversified does do the dependent life. As far as an HSA as well, they can set that up as well. We do offer life insurance, disability insurance, just depending on what your needs are. If it's for the entire group, we have various carriers that we work with. We also offer higher amounts of disability through one of our selling agents, Jake Ream. He can provide quotes for disability and for higher amounts of life. So we have it on individual basis and we have it on the group basis. And we do have a specific attorney's disability program through Sun Life. So if anybody is interested in that, Annette can get that information, or you can contact the info@profinsprog.com and I can provide you more information on that program as well. Great question.
I don't have any questions in the queue. So if any of you have an interest in knowing something about something specific to do with the plan, feel free to pop it in the chat box.
Exactly. Anything about the plan, any services that we offer. We do offer cyber insurance as well. That's one of the areas that our sales agent Jeremy is taking care of. So we're here for you, most definitely, for every aspect of your business and your life. Auto and home.
Here's another question that came in the context of the HSAs. Do you know
Yes.
if HSAs have to be used by the end of the year?
And that's a fantastic question. And a lot of people think that you have to use your HSA money by the end of the year. HSAs will roll over from one year to the next, potentially being almost like a forced savings if you don't use your HSA funds. They do have to be used for eligible medical expenses. We do have a list of those as well, just in case anybody is interested in that. Now, with the FSA, that money must be used by the end of the year for medical expenses. But the health savings account money can roll over from year to year. And your FSA, again, your employer can set that up. We can help you with that. Diversified Benefits works with that as well. Your flexible spending account, I should say, not your FSA. And it's nice when you have to get new glasses every few years. It's nice to use that money in that FSA or HSA to use get a pair of sunglasses, get a new prescription, contacts. There's a lot of things that are on and off the policy that are eligible for that pre-tax money.
You can also use that money to cover the deductible charges under your health care too, right? It's not just for those extras.
Definitely.
Okay, other questions? I wanted to just share with the group that when we put information out, we generally link to all of the resource information that Christine has identified too, so that hopefully when this comes out in the Inside Track or when you see it on social media, you'll find all the links to those as well. We have another question that came up in the chat bots, and that is, how long does it take to get a plan started?
We have actually, it depends. We have actually enrolled individuals within a couple of weeks. I kid you not. If the application is clean, everything is answered correctly, everything's filled out, and pre-existing conditions aren't really a factor, we can actually get final rates from underwriting within a couple of days, depending on their workload, but normally it's been a couple of days. When information is missing, say you mark that you're taking medication, but you didn't indicate any medication is on there, that's when we have to reach out and try to get that information. And sometimes that can be a little bit longer. People are on vacation, it goes into their voicemail. So as soon as we get that information back, we do provide that to the underwriting team so they can continue the process of the enrollment. We have everything electronic, so we can send enrollment applications directly to you. As far as the employee app, the employer app, that is, and if you do an automatic bank draft, you don't have to send in an initial premium. So that makes it a little quicker too, because WPS can get that information out. We can also do employee meetings. So if you do enroll in a plan and you want to make sure that your employees are understanding their benefits, we can certainly come in and go over the information with them as well.
So does that mean it's best to start at the beginning of the month? Can a plan be started at the middle of the month? Is there any, is one of those better than the other?
The plans normally start on the first of the month. So I always say, start the month prior to when you want the policy effective and try to get that within that first week. So we'll get quotes out to you within the same day. We'll have a 24-hour turnaround, but a lot of times we like to get them out even the same day so you can review and make your decisions a little bit easier. Once we get the applications in any of the enrollment material in from the group, we automatically send that directly over to underwriting. I want to say a normal time frame is probably 3 weeks to a month, depending on if there's needed information. But if you're looking for something, we like to have it in by the 15th of the month for the first of the month following. It gives enough time so that way everything can be put into the system. The prescription benefit can be sent off to Express Scripts. So there's no lag in getting your prescriptions. Your identification cards are in your hand before your policy starts.
Chris, I want to throw out something that I don't know if you've touched on yet. And I know you said initially that the plan can be changed. I'm not changed. You can enroll in the association health plan at any time. It doesn't need to be during the open enrollment period.
Correct.
But I've also heard members express some concerns about making a change outside of the regular cycle, so to speak, because of concerns over meeting deductibles. And how does that work? Can you share some details there?
I sure can. And thank you, Annette, for bringing that up. In my head, I was thinking about it and it just didn't come out yet. If you are currently on a group health insurance plan with your employer and you decide to enroll within the association, any deductible portion that you've already satisfied with your current group plan you can actually ask for a deductible credit report, and then we can submit that to WPS. Normally the insurance carrier will submit it to the insurance carrier just due to HIPAA. Individual options, you cannot, but group to group, you can have your deductible credited for any amount of your deductible that you've already satisfied. Very good question.
And we did receive another question. is there an app available to manage benefits?
That's a good question. Like a phone app, we don't have anything available. WPS does have their app. I believe you can actually do like a My Chart. So it would be your individual policy within that group. They do have the employer portal as well, that you can log into. I'm not sure if there's an app for that though or not, but and then the employer can look at the benefits and kind of keep track of things. But definitely as a consumer, as an insured, you do have access to your portal for insurance.
Okay, well, we have no more questions in the chat. If there's any questions you have, feel free to put those in there. There's been some great things mentioned today
There sure has.
that I think a lot of people are going to benefit from, just in terms of getting at a few more details.
Yep.
So feel free to go ahead and put that in there. I'm trying to think if I have another question I can throw out to you as well. I think I'm all tapped out too.
It's always when you hit the button to release, you're like, oh wait, just like the doctor's office. We're very easily accessible. So any questions that do come up after the program, while you're talking to other firms or other team members, shoot us an email. We'll be more than happy to answer those for you.
And I just want to, reiterate, Chris touched on, not necessarily needing to wait until the open enrollment period. At that point at the calendar year, she's absolutely right. It is crazy busy.
Yes.
You're nearing the holidays. You're nearing the end of the year.
Yes.
From my perspective, excuse me, I think this time frame right here is the perfect time to just sort of take a look, see what you have in place, see how it compares to the policy, get your rate quotes. Even if you want to think about it a little bit, you have time now. If you jump in and start looking November 1st, you have exactly 6 weeks, because your decision has to be made by December 15th.
Correct.
Have it in place by January 1st. So just something to think about when deciding whether to take that next step. It's probably better to take it now and have a little bit of a cushion of time to think about things.
It certainly is. And it's a little bit more, I don't want to say lax, but it's not as stressful now than it is in the fourth quarter, trying to make quotas, trying to, get your court dates. It is just crazy. And like you said, with the holidays, and then, there's so much going on that we want you to enjoy this process and not be stressed out on it. So we do encourage early enrollment because of the time frame, and because there's so much going on in everyone's lives in fourth quarter. So take a little ease and some stress off your plate.
And we did get another question submitted.
Sure.
When can you add a new employee once we have established an insurance plan?
Great question. New employees will be added depending on your probationary period set by your firm. Now, you can have a first day of hire, you can have 30 days, you can have the first of the month after 60 days, or the first day after 90 days. So you set your probationary period to what your firm wants. Your new employee will actually be eligible once that probationary period has been satisfied. And we normally like to get application in the month before the probationary period ends. So then that way, again, they have their ID card. Any questions that they may have, we can look up providers, we can look up prescriptions, see how it's all covered, do a little bit of legwork for that employee. But yeah, definitely, it's with the probationary period, you want to make sure the person works before you start offering coverage. So I don't recommend the first day of hire, but I do recommend at least a 60-day time frame. And they will become effective the first of the month after their 60 days. Now, if you do have, and anybody can be added, even if they waived off the coverage, when your renewal comes about. So say you take a plan out in July. So next July, if you have people who waived coverage, your renewal is going to be July 1st of 2022. We would want application for any waived employees or anybody who declined coverage in June, so we can have them added on July 1st. Another time that employees can be added on is if they had a special enrollment. They involuntarily lost their current coverage. They were married, they had a baby, got divorced, moved to a new servicing area. They can come onto the plan the day after they have lost their coverage. So say they lost coverage, it's effective August 1st. They just lost coverage, say September 2nd or September 1st, they can come on that plan as of that loss of coverage. So they have continuous coverage without any breaks.
Okay, well, Chris, I don't see any other questions coming up in the chat box. I see we're at 1:53, so we are right on schedule. I just wondered if you had any kind of closing comments you wanted to give before we sign off.
Well, as always, we are here as your exclusive association group health plan people. Again, you can get this plan only through our agency. We look forward to working with you and wish you much success, definitely. If you do have questions, please reach out to us. We're very receptive. Marketing is very receptive as far as any referrals that come through our website. We normally like to get everything done within a day's time, at least our first contact. And thank you everybody. I hope you have a fantastic rest of the week, and I look forward to seeing some inquiries.
And I wanted to just share that we will have another informational webinar. We have our date set for September 29th from 1 to 2 p.m. We will continue to promote that webinar just like we promoted this webinar. So you'll get an email and you'll go through the same type of process you did to access the link to learn more, in case you're still thinking about it, or if you're just interested in learning more in depth. I think Chris plans on focusing on some different aspects of the plan every time we have these webinars, just because it is very complex.
Definitely.
So please feel free to join us, watch for the emails. And in the meantime, if there's anything I can help you at the State Bar with, again, my name is Annette Ashley. I'm going to give you my email address. I should have had a slide and added it onto your presentation, Chris. But I'm at aashley@wisbar.org. And we did have a question come up if the slide presentation would be available. I'm assuming what we have done in the past is we've provided the link to the video and the slides, and Chris has put it up on the Professional Insurance Program's website.
Correct.
We'll have the information made available as well. So between one of the organizations, you'll be able to find it there. And if you can't find it, feel free to get in touch with me, and I will be happy to share it with you so that you can take a look at it, watch it again, and get all the information you need. So with that, I want to thank you as well for joining us today, and hopefully we'll see you back on September 29th. And in the meantime, enjoy the rest of your week, and please feel free to let me know if there's anything we can help you with. Take care.
Bye.
Thank you.